Narcisse.
Hi, Sharon.
As an expert in healthcare issues, I would like to ask you some questions about the diseases.
Yeah, sure.
So, global health seems to be in the news more and more in recent years. Talk about what global health is and why it is important to pay attention to it.
Okay, thank you. Global health refers to a combination of international objectives and initiatives that are research-based to set goals and strategies. And it's important to pay attention about it because it relates to health and well-being of people.
Okay, so disease come to us in different ways. Can you explain the difference between communicable and non-communicable diseases?
Okay, communicable diseases are those diseases that are spread by contact. For example, when someone is infected, can cause to be infected to another one by contact. Non-communicable diseases are those medical conditions which are non-infectious. It means it is not transmissible among persons.
Okay, so let's talk about Ebola. Since I'm sure most of our viewers have heard a lot about Ebola. What is it? Is it communicable or non-communicable? And how do people get Ebola?
Okay, Ebola is a rare and deadly disease caused by infection with one of Ebola virus species. Ebola is a communicable disease because once person is infected and he is or she is in contact with another one, the other person is also infected. Uh, yeah, that's all about Ebola.
Okay, so what would raise a person's risks of getting Ebola?
Okay, Ebola because it is deadly diseases, so traveling to the region where Ebola outbreak occurred can cause someone to get risks. Uh, have direct contact with someone infected also can raise risks for that person.
Okay, so to prevent or at least lessen the chance of getting Ebola, what should people do?
Okay, first of all, avoid traveling to areas where there is increased risk of getting Ebola virus. Do not touch the blood or body fluids of a person who may be infected with Ebola virus. Another thing is to contact or call doctors or medical facilities in case there is infected uh, symptoms of Ebola.
Okay, thank you. And an outbreak such as the one related to Ebola can generate a lot of rumors and misinformation and even panic about what the disease is, how it is transmitted, and how likely people are to get it. Talk about the need for educating people about facts versus myths.
I think in such cases, medical facilities should take the initiative to sensitize the causes, the nature of disease, the impact of getting infected, and showing some scientific facts about disease instead of let people use their autonomy to try to solve the problem or to counter the challenge, which is a disease.
Okay, so how about the complications that Ebola raises for the rights of travelers and responsibilities of the government? Kachihiko, for example, a nurse from Maine who returned to the States following a trip to West Africa in half of 2014,
Yeah.
promptly had quarantine-related restrictions thrust upon her, restrictions that she was very much against. So briefly describe the difficulty of balancing individual rights and government responsibility.
First of all, remember all governments have the role or goal to protect their nations. Also, it's good to respect human rights. So, here is a difficult when governments do not want the people to get infected by limiting those who are infected to get in their countries. So it's really difficult always for governments to take decision ethically so that it is fair. This is the reason why we see some government limiting people to enter in their countries when they are infected. Why you have to think that those people, even if they are infected, they are people, they are still human. So it's fair when we use other method to maybe to correct those who are infected, but not limiting them at all to enter in the countries.
Okay, so let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone who knows that smoking harms health. What does it do to the body?
Okay, first of all, effects of smoking probably are many. So, smoking is the main cause of cancer, heart diseases, and other chronic diseases. Uh, Mainly, poison from tobacco weakens body's immune system, making it harder to kill cancer cells. So, it's hard that body resist to disease when you smoke because smoking damages the cells in the blood vessels. Also, smoking is a major cause of cerebrovascular diseases and cause of every physics from cerebrovascular diseases. So, smoking is really dangerous to the human body.
So what about second-hand smoke? Explain what that is and how it affects people.
Okay, second-hand smoke is the smoke from burning tobacco product. It is also smoke breathed out by a smoker. For example, someone may be smoking around you or near you, and you can breathe the smoke without actually smoking.
So,
It can also cause heart diseases and stroke.
okay, interesting. People don't typically think of tobacco as a drug like heroin or cocaine, but the addiction it creates is strong, isn't it? Should we think of tobacco use as a form of substance abuse?
Sure. For me, as a healthcare expert, I think tobacco use could be considered as substance or drug abuse because its effect is really dangerous, and we see that the people are dying every day because of smoking. I think governments and international organizations should consider that.
Okay, thank you, Narcisse, for the information.